3 primary reasons your urinary stream weakens after age 55, and the simple solution to restore your strength and prostate health. Are you tired of feeling like your bladder never fully empties or struggling with that weak, hesitant, dribbling stream that turns urination into a frustrating, time-consuming chore? The good news is that a weak urinary stream is not just an inescapable part of aging. It is a symptom, and the correct diagnosis can unlock straightforward solutions. In today's conversation, I, Dr. Richard Powell, urologist, will reveal the 3 most common causes for the decrease in voiding strength, typical for men over 50. More importantly, I will give you the practical science-based fixes that can restore a strong stream, improve bladder emptying, and protect your prostate health for the long term. So stick with me because you don't want to miss this vital knowledge for maintaining virility in your mature years. Before we start, I'd like to know where you are watching me from today. Leave a comment below, and feel free to submit any questions you have about men's health. And of course, don't forget to hit the subscribe button and turn on notifications, so you never miss an essential men's health tip here from Health 365. First, let's talk about benign prostatic hyperplasia, or BPH as we call it. Among the many conditions affecting male urinary health, an enlarged or swollen prostate stands out as the main culprit for weak stream in men over 50. But how exactly does BPH undermine the force of your urinary jet as you age? Let's delve into the anatomy. Bladder muscle weakening is a consequence, but mechanical obstruction is the initial cause. The prostate tissue surrounds the urethra, the tube that carries urine from the bladder out of the body. As we age, it is biological. The prostate grows, a phenomenon influenced by hormones, particularly dihydrotestosterone, or DHT. This prostatic growth, which defines BPH, compresses or squeezes the urethra, creating a physical bottleneck. Seniors men your age frequently experience this narrowing, causing hesitancy, intermittency, and of course a progressive and noticeable weakening of the stream. The prostate acts like a tourniquet, demanding that the bladder work much harder to push urine through an increasingly tight pathway. This chronic obstruction leads to an overexertion and eventual exhaustion of the bladder muscle. The result is urinary retention and that persistent sensation that the bladder has not completely emptied. Including regular checkups with a urologist is crucial for monitoring prostate size and determining the index of obstruction. This is the foundation for the correct treatment. How does BPH treatment help restore stream strength and bladder function? The key is to reduce the pressure on the urethra. Without proper intervention, the obstruction can lead to serious issues including recurrent urinary tract infections, bladder stones, or in severe cases, kidney damage. Modern urology offers diverse approaches aimed at relieving this pressure, restoring your stream to the force of a younger man. What do you need to know about treatment options? There are alpha blocker medications like tamsulosin, which relax the muscles of the bladder neck, and the prostate itself, relieving the tightness on the urethra. They work quickly, improving flow in days, not months. We also have 5-alpha reductase inhibitors like finasteride, which work long-term by decreasing the actual volume of the prostate, by blocking the conversion of testosterone into DHT. To maximize treatment results, it is crucial for you to understand that it must be personalized. It is not a one-size-fits-all approach. Men can combine medication classes to get rapid symptomatic relief and long-term prostatic volume reduction. In cases where medication is not enough or the prostate is too big, we consider minimally invasive procedures such as REZU or UroLift, which use water vapor or implants to open up the urethra without open surgery, ensuring faster recovery and the total preservation of sexual function. To preserve prostate health, and ensure a strong stream. Healthy men can and should adopt preventative practices. It is important to note, however, that while lifestyle changes help, they do not cure an already established severe obstruction. Consultation with your urologist for a PSA and digital rectal exam is essential. Please remember that this content is for informational and educational purposes only. Always seek qualified medical advice for your specific health situation. Regularly exercising, maintaining a healthy weight, and limiting alcohol and caffeine intake at night can reduce irritative symptoms and nocturia, which are common in those with BPH. Stress also plays a role because anxiety can increase the muscle tone of the pelvic floor and the prostate, worsening obstruction and stream weakening. Stress management through breathing techniques or mindfulness can bring modest but measurable relief in symptoms. Seniors are more vulnerable to symptomatic progression of BPH, and early intervention is your best defense against the deterioration of urinary flow and the risk of kidney failure. BPH can cause weakness and nerve damage in the bladder if the problem is neglected, leading to an overstretched bladder that loses its capacity to contract. Saw palmetto supplementation is popular, but the scientific evidence is mixed. In my practice, I rely on proven treatments for this condition, which is so prevalent. However, for those who consume plant sources and seek alternatives, the standardized extract of this palm tree can be an auxiliary tool, but it never replaces prescribed medication. Low-free testosterone, often masked by chronic fatigue, can indirectly affect prostate health and bladder function. Testosterone is fundamental for the proper functioning of the bladder detrusor muscle. Inadequate levels can lead to a loss of contractile strength, contributing to incomplete emptying. This deficiency can affect the ability of nerves to communicate with the bladder, ensuring a smooth contraction and relaxation. Testosterone supports the integrity of the nervous system, preventing neuropathy that can manifest in urinary and sexual dysfunctions. Men with low testosterone levels frequently report general weakness and exacerbated urinary urgency. Low testosterone levels can be caused by natural aging, uncontrolled obesity, chronic stress, the famous burnout syndrome, and the use of medications that can affect hormone production. Testosterone deficiency can cause bladder muscle atrophy, loss of contractile strength, and reduced nervous coordination. Men your age should have blood tests to check testosterone, B12, and vitamin D levels to get a complete picture of their hormonal and metabolic health. Testosterone is crucial for the health of smooth muscle, which makes up most of the bladder. What happens when levels drop too low? The bladder becomes less efficient and more flaccid. Furthermore, testosterone is an important factor in maintaining healthy prostatic architecture, and untreated imbalances can influence the progression of BPH symptoms. A man who has a mild prostatic obstruction, but also has a weak bladder due to low testosterone, will have a far worse stream than a man with the same obstruction but normal testosterone. This is why a hormonal evaluation is essential when investigating weak stream. One egg contains about 40 international units of vitamin D, but the recommended daily dose for the health of your muscles and blood vessels is 800 to 1,000 international units. For those seeking to optimize testosterone naturally, it is vital to incorporate strength exercises, which have been shown to elevate free testosterone levels. Get 7 to 9 hours of quality sleep, since the highest hormone production occurs during deep sleep. Weight control, especially reducing abdominal fat, decreases the aromatization of testosterone into estrogen, a process that weakens the system. Supplementation with zinc and magnesium, crucial minerals, can support testosterone production and overall muscle health. While testosterone replacement treatment is highly effective for eligible men with hypogonadism, this treatment must be strictly monitored by a doctor. it is not something to be done at home. Hormone replacement therapy has specific indications and requires the urologist to closely monitor PSA and hematocrit levels to ensure the safety of the prostate and the cardiovascular system. For most older men, effective BPH management combined with hormone and muscle function optimization can reverse stream weakness. Dr. Powell wants to know if poor eating habits or a sedentary lifestyle can worsen stream weakness and how diet can help. Yes, lifestyle directly impacts bladder function and prostate inflammation. A sedentary lifestyle leads to poor circulation, which impairs the delivery of oxygen and nutrients to the bladder and prostate. A diet rich in processed foods, sugar, and saturated fats promotes systemic inflammation, which in turn can increase prostate swelling and worsen urinary symptoms. An anti-inflammatory diet rich in phytosterols can mitigate BPH progression and optimize bladder performance. Phytosterols found in nut seeds and specific vegetable oils have demonstrated potential to reduce prostatic inflammation and consequently pressure on the urethra. A diet rich in vegetables' omega-3 fatty acids found in fatty fish like salmon and sardines and adequate water intake ensure hydration and reduce urine concentration, minimizing bladder irritation. An adequate intake of vitamin B6 naturally present in bananas, pork, and some grains is fundamental for nerve function, including communication between the brain and the bladder. Vitamin B6 helps regulate neurotransmitters that control muscle movements, reduces inflammation, and supports red blood cell production, ensuring that the bladder muscles receive oxygen efficiently. A B6 deficiency can therefore contribute to voiding dysfunction. Magnesium found abundantly in pumpkin seeds. Almonds and cashews is another vital mineral. Magnesium is essential for muscle relaxation and nervous function. It helps reduce muscle excitability, preventing sudden spasms in both leg muscles and pelvic floor muscles that can contribute to obstruction. Most men over 50 are deficient in magnesium. A lack of potassium can lead to cellular dysfunction. Potassium present in bananas, avocados, and spinach helps transmit electrical signals between nerves and muscles. When potassium levels drop, the transmission of neural signals to the bladder and sphincter can be impaired, resulting in weak or uncoordinated muscle contractions and an ineffective urinary stream. How do pelvic floor exercises contribute to a strong urinary stream? While BPH is an obstruction problem, the pelvic floor can be an ally. Pelvic floor training, or the famous Kegel exercises, strengthens the muscles that support the bladder. This improves control and coordination during urination, helping the bladder empty more efficiently and controlled. However, it is vital that men do not excessively strain these muscles. Hypertonicity or excessive tension in the pelvic floor muscles can actually worsen BPH symptoms. The correct technique is to relax the pelvic floor during urination and use it for a gentle final emptying. If you have urinary symptoms, consult a pelvic physiotherapist. Men with diabetes or other diseases that affect peripheral nerves should worry about neuropathy, which can paralyze the bladder. Diabetic neuropathy damages the nerves that tell the bladder to contract, leading to very slow and incomplete emptying. If your stream is weak and you have diabetes, rigorous blood sugar management is one of the best strategies to protect bladder nerve function. Ingesting foods rich in vitamin B12 like eggs and lean meat supports nerve integrity, crucial for brain-bladder communication. Neurogenic bladder caused by nerve damage is a serious cause of weak stream. In these cases, the solution involves managing the underlying chronic disease and sometimes catheterization. To maximize urinary system health benefits, men should drink at least 6 to 8 glasses of water daily, limiting the intake of irritating fluids like coffee and alcohol, especially in the hours leading up to sleep. Excess fluids at night are the main trigger for nocturia, which is waking up to urinate. Avoiding constipation, which can mechanically press on the bladder and prostate with high fiber intake from fruits, vegetables, and nuts, also helps alleviate symptoms. In summary, stream weakness after age 55 is primarily a mechanical problem of prostatic obstruction, BPH, but is aggravated by bladder weakness resulting from age hormonal imbalance, particularly testosterone and diabetic neuropathy or essential poor nutrition. You should consume a variety of nuts and seeds daily, such as pumpkin seeds, almonds, and cashews, which are rich in magnesium and zinc for prostatic anti-inflammation. Combine with potassium-rich fruits like bananas for nervous and muscle function. And do not neglect complete protein like that from eggs, which maintains bladder muscle strength. If you found this information useful, please remember to click the like button. That really helps us bring more valuable content to you. Leave a comment below and tell us what you thought your questions or what men's health topic you would like us to cover next. We love hearing your feedback. Of course, click the subscribe button and turn on notifications so you never miss our latest health tips and insights. Stay informed, stay strong, and we will see you in the next video. Remember, men aging does not mean losing potency.